Healthcare enrollment is here. Medicare enrollment already started earlier in October. We're just a little over a week away from the Affordable Care Act health enrollment period. If you haven't thought about either, now is the time, and we are joined by our experts, Medicare and ACA experts, to help you out this evening. We've got Catherine Sevier from AARP North Carolina, Laura Packard with Get America Covered, Steve Edmonds from Alliance Insurance Services. These folks are here to answer your questions. So this is how you get your question to our experts. The number is 336-379-5775. Remember, you get your question answered in real time, but the question is anonymous, so ask whatever it is that you want to ask. All right, first and foremost, we're going to start with just the basics, and that is the calendar. So let's put up the calendar so everyone is clear on the dates for either Medicare or the Affordable Care Act. Okay, so you see Medicare enrollment began earlier in October. That's in the orange. You'll also notice orange in December because that's when Medicare enrollment ends. That is December the 7th. Look at the blue. That is the ACA enrollment, and that begins November the 1st, and it ends January 15th of 2023. Okay, so Steve, for folks who are like, well, I'm already signed up for Medicare, so what does that mean for me?
Okay, so this is just a time of year beginning on October 15th each year where we have an annual enrollment cycle that comes around. And it's just the perfect time to reassess your plan each year. Lots of stuff to look at with your plans, like what's your maximum out-of-pocket cost on that plan? What are your co-pays on the plan? How is the drug coverage? Is it going to be as good as it was last year? Is it going to be better? Is it going to be worse? And then you have the extended benefits like vision, dental, hearing, and over-the-counter drug coverage that also comes with a lot of these plans. So this is just a great time of the year to reassess your plan, and don't be afraid to do that. I mean, there's tons of plans out here, a lot of options, and it's just a great time to go over it good, examine it good, and consider, do I need to make changes or am I good where I'm at?
Okay, so that's for folks who already have Medicare. So what if they're like, I'm coming up on 65-ish. Is this my enrollment time? Okay, so Catherine, let's answer that.
So 65 is the golden year that you have to sign up for Medicare. So you want to make sure that you do it 3 months before, the month of your birthday, or 3 months after. Even if you are insured, you still need to sign up for Part A and check with your employer to make sure, if you're not going to sign up for Part B because you have other insurance, that your insurance is a qualified policy for you. If it isn't, you will pay a penalty forever when you do sign up for our Part B benefit, which is all your doctor's visits, radiology, and most of your outpatient activity.
All right, so if you are, coming up on the age of 65, this might dovetail with Medicare enrollment, but if it doesn't and you turn 65 like in July of next year, you're going to hold off and wait for that 7-month period. Again, the 3 months before, the month of your birthday, the 3 months after, that kind of thing. Okay. Laura, let's go to you. Let's talk about the Affordable Care Act, because once again, enrollment is coming up. It starts November the 1st. What do people need to know?
Well, you can start shopping right now. You can go to healthcare.gov and see what plans are available. So you can do a little window shopping now before November 1st. You want to make sure that you sign up before December 15th if you want your plan to start on January 1, but you do have until January 15th. If the holidays are just too much and you can't quite get it together, it just means your plan will start a little later in February. So start shopping now.
Right, and I know that seems like a long time, but once you get into the holidays and stuff like that, people then start looking at other things and they don't start paying attention to their enrollment, and it can kind of sneak up on them. If they have ACA enrollment from last year and they think to themselves, well, if I don't do anything, it'll just stay the way it is, what would you say to that?
Well, your plan should auto-enroll, but I would strongly suggest checking out your options because plans come, plans go, they change. The same plan that you were on this year is maybe not the best one next year. And also, if your income has changed at all, it could be that you're eligible for more financial help. So definitely you should go to healthcare.gov and go through your options rather than just auto-enrolling.
Okay, and here's something else too. Healthcare.gov has all the things listed there. They have some helplines as well. But Steve, I know if folks talk to an insurance agent, they can have the insurance agent kind of go over certain things with them to help them steer them to a plan. You don't have to pay for that.
That's correct. And we hear that a lot. The healthcare.gov system, it's really great anymore. I think it's very user friendly and really easy to do. But that's one of the biggest things I hear on a day in, day out basis is people get confused when they start looking at that and looking at the plan options, and they don't really know what to sign up for. And sometimes they don't know exactly how to answer all the questions that's asked on the computer. So an insurance agent can help navigate that for sure. It is free. There's no cost to do that. And a lot of times, if you go ahead and sign up with your plan through that agent, you've got him to help you throughout the year as questions come up as well. So using a qualified agent or navigator is a really good source with the ACA, I think.
Mm-hmm. All right, so we're taking your text questions. I already have a list of them. Feel free to text in your question. We want to answer them for you so that you have all the information that you need for healthcare and Medicare enrollment. We'll be right back.